On the Coronavirus Watch today, Governor Brown holding a press conference to address the recent surge of the Omicron variant over the recent weeks. She spoke alongside multiple health experts, emphasizing the importance of getting vaccinated to help do your part in the fight against COVID-19.
If you take one thing away from today's press conference, let it be this: get your booster shot. Boosters work and are incredibly effective at continuing your protection against this virus and hospitalization. And if you aren't yet vaccinated, now is the time. This truly can be a matter of life or death.
Governor Brown announcing a goal of getting 1 million Oregonians their booster shot by the end of January, saying that she's allocated the distribution capabilities and vaccination supplies to do so. The Oregon Health and Science University is predicting that the Omicron variant will eclipse the Delta surge in the state. Their new forecast says the Omicron variant will drive a wave of hospitalizations higher than any of the past surges in the state. They say the forecast highlights the importance of booster shots, especially for people more vulnerable to severe illness. One doctor at OHSU says it'll be about 2 to 3 weeks before we see Omicron accelerate and become the dominant strain. Yesterday marked 1 year since the COVID-19 vaccine became available to Oregonians. Now, here we are 12 months later with an emphasis on booster shots as the Omicron variant spreads. Brian Gooden attended Governor Kate Brown's press conference on December 16th of last year, where the first COVID-19 shots were given in Oregon. For him, it was a day of celebration. But Gooden admitted now that celebration was a little premature. Where we are now is not where he thought we would be a year ago.
We just in the U.S. have just hit 800,000 deaths from COVID. Almost 800 of those deaths were children. And in Oregon, we've hit more than 5,500 deaths, and 5 of those were children. There are staff in every hospital in the state that are still really working hard to the point of exhaustion.
As for what they see happening over the next year, these healthcare workers expect more variants will likely arise, and COVID will likely stick around, sort of like the flu.